you'll have just seen the message come up as well that we've got Melissa here today as our BSL interpreter. Hi Melissa, I shall try and not talk too fast so you've got a chance to keep up with me. Just double check. Right, let's get started, and there might be more people join as we're going through. So welcome everybody, and some familiar faces, so hopefully you'll know the format that we follow, but I also know there are some new faces of people that have just joined us in the organisation and in the system. You're all very welcome. We're doing these every 2 weeks. This is the 23rd all staff dial-in that we've done, and it usually takes about 30 minutes, and we just ask everybody else to stay on mute so that we don't get any kind of background interference. If you've got any questions that you want to ask of anything that I'm covering, please just use the chat and I'll try my best to cover them. If not, it just gives us somewhere to go away and get the information that people want. And in the meantime, if there's any particular areas you want me to cover, please do use that email inbox. As I've said, we've got Melissa with us, and if you want to pin Melissa in the corner of her screen, then she'll stay on your screen throughout, so you can follow the translation that she's doing for us. So if you just go on to the next slide for me, please, Sarah. So I always start and ask and offer a huge thank you to everybody. It feels as though as each week goes by, we continue to have to adapt in very different ways because of the restrictions that are in place. And I know both from a personal and a work point of view, that sometimes can make things really tricky, especially when you're responding to impact of schools, if you've got young children, looking after vulnerable people, people that are at increased risk, and making sure that everybody stays safe and well. And what I continue to see is how you're all adapting week in, week out, trying to navigate through what continues to be very challenging circumstances. So thank you. And I also know, in terms of the impact that we're seeing at the moment from COVID, we continue to have none of our inpatients in any of our sites is positive for COVID. We're continuing with our testing, and where we've had some staff unfortunately test positive for COVID and we've been contacted through track and trace, that's been really minimal disruption. We're not seeing big impact across our teams, and that's not the case in all organisations. And again, that's because you are all doing your utmost for that personal responsibility, keeping yourself safe, maintaining that social distance, and using your PPE. And we have got adequate supplies of our PPE thanks to the ongoing work of our supplies, our logistics team, making sure that we've got enough in place. And they did a fantastic update to our Council of Governors just a few weeks ago, just showing the amount of work that's taken place behind the scenes and continues to be there hidden from view. So a huge thank you, and that's the work that will continue to happen over the coming weeks and months. Just go on to the next slide for me, please, Sarah. So a bit of an update on the news. Well, this is the latest. I'm quite sure there's probably other news been announced while we've been in work today. Who knows? That's the reality of how it feels like at the moment. However, some things are really clear. For a number of weeks, we have colleagues that work over in Greater Manchester. We have colleagues that work up in the North East, and Leeds now are under these local lockdowns and enhanced restrictions. As we know, even our own government ministers don't always understand what those rules mean. Please do go on to local government websites to understand what it means for you in terms of where you live. And you might not live in Leeds, but when you come into Leeds to work, we've got to follow those restrictions. You might live in Leeds to go into York. York has not got the same rates as Leeds. So some surrounding areas in particular, as we go over the boundaries into North Yorkshire, I've not got those enhanced local restrictions. So please just keep yourself safe. And if you're not sure what the rules are, go onto the local government websites. The CCG in Leeds has done a guide there, which we sent out earlier this week, just some frequently asked questions to help make it as clear as possible. And we are, as a system across West Yorkshire, talking about how do we get the messaging simpler, which explains what you can do rather than just a list of all the things that you can't do. That's not really good in terms of mental well-being. A reminder, if you've not seen it, it's been advertised a lot that the launch of the COVID app is now out there, the NHS COVID app. So please do download that to your phone. It makes it easier in terms of that track and trace, and if you're going out to venues, not having to give all your personal details over. We know that isn't going to be the solution in terms of keeping us safe from COVID. It's one of the tools that will help, but it certainly isn't the big solution that people a while ago were hoping for. There is now, yesterday, there was a live stream of a conversation with 4 of the local GPs, also answering questions about coronavirus. So if you're interested in that, have a look for the Facebook page for NHS Leeds, and that video is there widely for other people to see. And just a reminder, please do, if you've got symptoms or somebody in your household has, do get a test. I know there's probably a sense of what you're hearing, that there's delays in accessing tests. Don't let that put you off. If you're concerned, get access to a test. If you're not able to go through the routes, you can go through that mobile number that's on the screen there, or contact us, contact the HR team on the help desk, and we'll do what we can to enable that access to testing. If we've not got the numbers going through, then we're not really going to be able to sort out the issues of access and demand for tests. And hopefully we're nearing the date when the research on trialling the vaccine will go live. So thank you for those of you. I know a significant number have already registered to take part in that research. If you've not done yet and you're interested, please do go onto the R&D section of the website and make sure that your details are on there. We want as many people as possible to take part so that it covers as much as the population, and that will help them get the results of that research sooner rather than later, which I think we'll all be pleased with. Just go on to the next slide for me, please, Sarah. A few weeks ago, we let you know that we'd appointed now Freedom to Speak Up ambassadors. Thank you to all of those that applied. And these are the 5 that are following a process of interviewing done by John and by Wendy and colleagues, have been appointed into the role. So we said we'd show a bit more information about them. So here's the photographs and the names, and you'll see we've got a good cross-section across the organisation of people in different roles, in different teams and departments. You can approach any one of those guardians, and you can also go directly, to those ambassadors, and you can go direct to John still as our Freedom to Speak Up guardian. This was all about creating as much choice and diversity as possible so that you all feel as though there's somebody there that you feel safe and you feel comfortable to approach if you've got concerns and you want somebody to help support you in addressing those concerns. John's organising some training and will continue to support them directly. And hopefully in due course, once they've managed to get a few months under the belt, we'll be able to hear a bit more about how they're experiencing the role. And certainly one of the things we've talked about is how do we in the future perhaps expand the roles of the ambassadors, have more ambassadors. So we'll learn from these 5 guinea pigs and see where that takes us. Just go on to the next slide for me, please, Sarah. National Inclusion Week. So thank you very much. We have been trailing this for a number of weeks because we wanted as many people to get involved as possible, and thank you. The number of people that got involved, I think in the end, was more than we could capture in the video that Tricia and Matt have put together for us. I know Wendy and Robin, they certainly came around here. We're out and about, visiting sites, encouraging people to take part. And these messages are really personal about what does inclusion mean to you. And that's really important because, you know, inclusion is about our values, about who we are as people and what our commitment and our offer is to others. So there's going to be some photos in a minute, but just a reminder, we've been setting out for a number of months now our expectation that we want everybody in LYPFT to really play their part in making us an inclusive organisation, and that then means taking proactive steps to tackle and eliminate discrimination in our organisation, not only for our staff but the communities that we serve. We've all got a role to play, and only by us all playing that role could we actually make a meaningful difference. So these videos and the photographs that people have sent in are really important because they're around that personal commitment to help be part of that change. There's also a digital partnership event tomorrow, which is really looking at different and diverse ways to create inclusive cultures. So if you've not got the details for that and you're interested, please do get in contact through the inbox there, and the link will be sent to you. Just go on to the next slide for me, please, Sarah. So here's some photos. Thank you very much. I don't know whether the people in these photos all knew that we're going to be in this Zoom as well as in all of the media that we've been sending round and about. But as you can see, every one of those, the boards that people are holding up is somebody's own personal reflections on what inclusion means to them, and therefore what they no doubt offer to those that they come into contact with. If you've not seen it, it is out there on social media. There's a well, it's just simply beautiful, the clip that's been put together, showcasing as many of these pictures as possible and people's personal testimonies. So thank you very much. And that really, if you just go on to the next slide for me, please, Sarah, sets us up nicely in terms of what's coming up. So you may not all know, but October is Black History Month, so from tomorrow, and through the work of our Race Equality Network, colleagues that are part of that and beyond, they've been working really hard to generate ideas and pull in other people external to the organisation to have a whole set of events celebrating Black History Month. So you can see there's a schedule of events week by week. And what's really important, if you think about Flag Day celebration and the different events that are on, whether it's the carnival, the membership of the panel that we're going to have in October, and we're going to finish the month with a comedian, there's a huge diversity in terms of the different communities that get, you know, kind of categorised from a Black, Asian and minority ethnic point of view, and even in terms of what gets classed as Black communities, whole diversity in there, and a huge thank you to everyone that's been involved in really bringing that diversity to the fore. So that's going to feature a lot in the communication that you're going to see from us, and certainly we'll be giving an update in another couple of weeks' time. So please do get involved and help us celebrate all of our colleagues as part of that. Just go on to the next slide for me, please, Sarah. It's that time of year again, believe it or not. There are some things that are in our annual calendar that remain in our annual calendar, and this is a really important one. So it's our staff survey 2020, and we're just about to launch that. So everybody will be getting an invite to take part online. We will, for those that don't want to access it or are not able to access it online, continue to provide paper copies, because everybody needs an opportunity to give their feedback. It really doesn't take that long, and the feedback is really, really important. So please do take the time, if you can, to do that staff survey. And we'll be sending lots of reminders out. When you do it, it is confidential. All of the data goes to Quality Health, and what they do is they analyse the data and they send the results back to us, and then we'll get that benchmarked in the new year against other organisations. But for everybody that takes part, they will put everybody into a hat, and people will have the opportunity to win vouchers as a thank you as well. But I just want to reassure you it is confidential. Nobody else gets to know what you personally have put in that survey. But the more information we get back, especially at a team level, if we get at least 11 back per team, then each team can get their own report. Because what we know is there's big variation between teams as well about your experiences. Just go on to the next slide for me, please, Sarah. And it's also that time of year where we're all getting our flu jab. So it's, I suppose, more important than ever, especially because I know there's a lot of concern at the moment of people not knowing if they've got symptoms that are the cold, the flu, or that the coronavirus. Some people are particularly vulnerable. The risk of coronavirus and flu at the same time, no doubt, is something that we want to do something about. Last year, we had our biggest uptake of flu back across our organisation, and this year we want to get beyond that. So please do. There's not going to be the same kind of walk-in clinics because of social distancing. We're not able to run them in that way. So please do contact us at the dedicated email address in order to book in for your flu jab. If you've had it elsewhere, if you've had it off your GP because you've got a long-term condition that means that they provide it for you, please do just let us know rather than us keep sending you reminders. And just so that you know, there we're again this year supporting UNICEF's campaign. So for every jab that we give, then a jab gets donated into a third world country to help vaccinate in other communities, which is an important benefit of us doing it in this way. Just go on to the next slide for me, please, Sarah. So I've gone through this quite quickly because we're only 15 minutes through. So these are some of the reasons I wanted to share in terms of reasons to be proud. So believe it or not, the Northern Gambling Service has now been up and running for, well, it's over a year now, and has seen over 400 patients in that time. You know, this was a service that never existed before. So that's 400 people that until this service set up were suffering and had nowhere to go. It's a small team, a huge thank you, already making a big difference to the lives of people who've got a gambling problem, but their families, because the harm that it creates is felt across whole families. And they will continue to hopefully share with us the fantastic work that they're doing. They've adapted really well through COVID to deliver the service in different ways, being as flexible as they possibly can. There's this week's blog is from Caroline Bamford, so we've just referenced that there, and she's talking in more detail around what inclusion means to her. So please do have the opportunity, take the opportunity to read that. And then I'm going to move across to this side of the screen. So a couple more here. Gina White, who works in the medical staffing department, and Tariq, who's one of our consultant psychiatrists, have been celebrated by the University of Leeds with long-standing service awards to undergraduate education. So Gina, because of all the work that she does, helping coordinate, manage student placements, making sure that they go smoothly, supporting our consultants in their role in training and educating students. So a huge thank you to Gina, and a huge thank you to Tariq. And some of the feedback for him is, as a consultant psychiatrist, that he's inspiring to new students. He provides training, education, as well as supervision in the workplace. Really important, because that's about the future generation of the workforce that's coming through. We do get fantastic feedback on the undergraduate training we provide across all of the disciplines in LYPFT, and that's really fantastic and really heartening for that longer term impact that you are all making. I've not seen this film yet, but in the bottom there is a film has now been made, thanks to, again, Tricia and Matt, with Joseph and colleagues and service users and carers about the working age adult community mental health teams. So let's make sure that we get that shared once it's been through final editing, and I look forward to seeing that. I know that our CMHTs did a huge amount of transformation work last year, and again, I've continued to change how they are operating through COVID, with a lot of learning of changes that they're going to keep in place. So thank you very much. And there's one that's not on here, which I'm going to make a special mention of. It was remiss of me not to have passed it through to Lucy and Sarah beforehand. So tomorrow, the 1st of October, we go live with the formal contract for the Adult Eating Disorder Connect service for West Yorkshire, which we've been running as a pilot for the past couple of, over 2 years now, 2.5 years. It has been delayed through COVID. And what the Connect team have done is they've took responsibility for the whole of the budget for specialist adult eating disorder services for West Yorkshire, and through changing the model of care, reduce the number of people that need to be in hospital, reduce people that are going out of area. So the only 2 service users in the last 2 years that have gone out of area is because of choice, and we've supported that choice, but not because of lack of capacity or demand. And they've used the savings from that to invest in community roles and community teams, and they continue to evolve it, running a lot of different groups, peer support worker roles now being recruited as part of the team. And so we put in a bid to take on the formal contract for that for the next 4 years, and we've been successful. So I hope that they're celebrating. Well done to the Connect team. You've done fantastic work over the past couple of years, and I know that that's going to continue. And I think that is all of what I was going to share today. Last time, you see, I was joined by Joe Loftus, who was giving us all some tips on looking after our posture, especially when we're working from home. And I've certainly been following that, moving from room to room and not sitting in the same position. So if you've not seen that, do take the opportunity to go back and have a look. Make sure that you're looking after yourselves in terms of musculoskeletal issues, and obviously the consequences for your mental health as well. I don't think there's any questions come through.
Nope.
No?
Nope.
I'll pause a minute, see if there's anything anybody wants to ask and springs to mind. I don't know whether, I'm just going to scroll through and see if Tricia joined us. Oh, there she is. You're on the second screen. You were late joining, Tricia. I was hoping, Tricia, you would put in, if it's possible, the link to donating. So for those of you that don't know, Tricia has been walking a mile every day in September. Today's the last day. And she's been doing it to raise money for a dementia charity. And it might sound straightforward enough, but a number of years ago, Tricia actually broke her back in a number of places and walks with aids. And I think the fact that she's done this and has been sharing it on social media, so if you follow Tricia on Twitter under End Stigma Leeds, you'll be able to see the journey that she's been on. And when I saw her in person, from a distance, of course, when out and about doing the footage for Inclusion Week. It was great to see you and looking really well. I know the weather's not been on your side today, but well done, Trisha. I think that's fantastic. And it's nice to see you smiling. Right, thanks very much, everybody.